Hi, I'm Roy Soto, one of the anesthesiologists here at Beaumont Hospital in Royal Oak. This brief video will give you an overview of Aidet, which is an acronym that represents a simple way to improve the service component of the care that we provide to our patients. Although we typically think of safety and quality when discussing means of improving care, more and more focus, both in the private and in the government sectors, is being turned to patient satisfaction. As physicians, we tend to think that our bedside manner is exemplary. However, many of our complaints center around physician communications, specifically related to lack of introduction, lack of procedural explanation, and overall lack of customer service. Although we tend not to be fans of acronym-driven initiatives, Aidet has been adopted at hundreds of hospitals throughout the country and is the language of service excellence that our nurses and support staff are taught here at Beaumont. Many of you have used Aidet in some form or fashion unknowingly for years, and the components seem to be common sense for most. The A in Aidet stands for acknowledge. Each patient should be greeted in a pleasant manner, ideally by name. Knocking on the door, making eye contact, and spending time talking before turning your back to work on the computer are all parts of this common sense acknowledgement. I stands for introduction. Introduce yourself by name, by profession, and by role. In a sea of white coats and scrubs, it can be very confusing for a patient to understand the differences between a phlebotomist, a nurse, a physician assistant, a student, a resident, or an attending physician. D stands for duration. The patient and family should have a realistic time frame for wait and/or procedure times, and this should be reinforced if delays are expected to occur. E stands for explanation, and this means explaining what you're going to be doing or ordering for the patient in appropriate language with a minimum of acronyms and abbreviations. A great way to improve the impact of what we're explaining and the effectiveness of our communication is to have family members engaged as well. T is for thank. Quite simply, thank the patient for their time, for their attention, and for choosing Beaumont.
Come in.
Hey, Mr. Jones?
Yes.
Hey, how you doing today?
Very good.
Great. I'm Roy Soto, Dr. Soto from Anesthesia.
Nice to meet you.
It's nice to meet you too. I understand you're having surgery today. Is that correct?
That's correct.
Fantastic. It looks like Dr. Smith is going to be taking out your gallbladder.
Yes.
Fantastic. So we're going to talk a little bit about how we do our anesthesia today. First, we give you some medicine through your IV to help you get a little relaxed. Then we'll take you back to the operating room, give you more medicine until you're all the way asleep. Now, once you're all the way asleep, we do put a little breathing tube in your mouth, which comes out before you wake up, so you're not aware of it, although you may have a little scratchy throat afterwards. That's pretty common. Okay. And then afterwards, our job is going to be to make sure that you're as comfortable as possible, meaning that your pain is well controlled, you're not nauseous. The whole process takes about an hour and a half for the surgery, maybe another hour in the recovery room afterwards. So once you leave here, it'll be about 2.5 hours until your family sees you again. Now, I know that we're scheduled for 10 o'clock, and I think we're running about 15 minutes behind right now. And we'll give you updates if that moves at all. Do you have any questions for me?
No, you've explained it very well.
All right, thank you very much. Now, I work with Dr. Smith all the time. He's a fantastic surgeon. I think you're going to do very, very well today. All right, thank you very much. Thanks for coming, and we'll see you here in a little bit. Don't go anywhere. I'll meet you in the operating room.
All right. Thank you.
Thank you. Service excellence, along with quality and safety, are key pillars of the Beaumont experience. Please keep Aidet in mind when interacting with patients, and remember that we, as physicians, serve as role models for all other hospital employees. Thank you very much for listening.